They suspended my privileges, and they did it in a very public manner. I actually found out about the suspension from a text message from a reporter at the Houston Chronicle.
So I imagine that most of our viewers or listeners are familiar with your name, but they may not know your entire backstory. They just kind of know some high level information. So I wanted to start off just by giving you an opportunity to talk about what's been going on in your life in the last 3 or so years.
Yes, so I'm a ear, nose, and throat and sleep medicine specialist in Houston. I have a solo practice. Prior to the pandemic, I actually took some time off because I have four young boys, and I took some time off from work and wasn't even sure I was going to go back to work. But then I opened my solo practice 6 months before the pandemic started. And as people started getting sick, I started testing patients. And you may remember it was really hard to get a test initially. And if you were able to get a test, it took 2 weeks to get the results back. Well, I had a lab that I'd already been working with chronic sinusitis patients, and they had a saliva test that results could come back in 24 hours. So my little practice exploded with COVID patients just because we had that test. And then, patients would test positive, and I would tell them to go see their primary care doctor. Well, we know how that went. So I started trying to treat them the best I could. And, we did breathing treatments. We did breathing treatments in people's cars. Initially, I didn't know about ivermectin. I just did steroids, antibiotics, breathing treatments. Then monoclonal antibodies came around, and I used those, and those were great. And initially, I could order them directly from the manufacturer and have as many as I wanted, and I'd have them the next day, and it was great. And then the government took over the distribution, and it became harder and harder to get them. And finally, they shut down monoclonal antibodies entirely. And so that's when I turned to ivermectin initially, and then I started, doing more from that. And to date, now I've treated over 6,000 COVID patients, and everybody that received early treatment is alive and well. Um, because we were doing a lot of testing, I started seeing all the breakthrough cases when the vaccine rolled out. And I had a lot of people coming to me very distraught over the mandates because they were having to choose between their job or their school and getting this experimental shot. And initially, I was neutral on the vaccine. I wasn't sure what to make of it. But then I started seeing all these breakthrough cases, and I even reached out to Methodists. I was collaborating with Houston Methodists at the time. I was sharing my data. We were doing research together. And I said, "Hey, I'm seeing all these breakthrough cases. Are you seeing the same thing? I wonder what's going on." And of course, their response was, "Oh, well, just lessens the severity of the disease, right?" But they never have shared their data with us. We don't know how many are hospitalized and who were vaccinated. So I started speaking out on Twitter about what I was seeing. I also sent an email to my patients saying that I was going to prioritize seeing the unvaccinated based on what I was seeing. That email went viral, and after tweeting about I basically tweeted vaccine mandates are wrong. I did that 25 times in one day. And a few days later, Methodist, which was the first hospital in the country to mandate the shot, they suspended my privileges, and they did it in a very public manner. I actually found out about the suspension from a text message from a reporter at the Houston Chronicle. That's how I found out privileges were suspended. And then they went on Twitter and tweeted that I was spreading dangerous misinformation that was harmful to the community. So because of that's how you know me, basically. That blew the press came after me, and then they reported me to the medical board for basically, I resigned immediately after they did that because I wanted nothing to do with them. And they reported me to the medical board, and I'm still fighting that. And then, myself and 2 other physicians have sued the FDA over what they did about ivermectin. They launched a social media campaign saying that ivermectin is only for horses and patients should not be taking ivermectin. And we all know that tweet, the attractive healthcare woman nuzzling the horse. You don't even need to know the caption, but that tweet went viral, and they really caused a lot of problems. I still have problems getting pharmacists to dispense ivermectin. I still have patients that are worried about taking ivermectin, and I'm still dealing with the medical board because of the ivermectin issue. So we sued them, and initially the case was dismissed. But recently, we won on appeal, basically saying that the case can move forward. We're still fighting. But during that case, the attorney for the FDA did admit that doctors are allowed to prescribe ivermectin for COVID. So that was a big win.
It seems like every day we wake up and the news is just more and more on our side every morning. And it's frustrating because you think how many lives could have been saved, helped, if they had just told the truth.
Exactly. It's very sad when you think about how many needless deaths and these shots. I mean, I looked back at my last 2 years and found that 7% of my new patient appointments were for patients suffering from injuries related to the shots. And I don't see patients coming in with strokes and myocarditis. I see sort of the lower, the chronic but debilitating problems that people are living with. And it's very sad because usually they've gotten the $1 million workup. They've been told it's all in their head. They've spent so much money and time, and they just get gaslit or dismissed. And it's a big problem. And you'll most of the time they haven't been reported to VAERS, from what I've found. I'm the one that does it, even though they've seen multiple doctors. It's very sad.
There's been,
So
something. Go ahead.
you are actively reporting to VAERS on a regular basis.
Yes.
Okay.
Yes.
That's great,
I'm not.
because most doctors won't go through it.
It's not that bad, actually. I mean, it's 5-10 minutes. I haven't found it to be too much of a burden, and yeah, I'm not seeing as many new patients now. Luckily, I think people have wised up, and so you're not seeing that many patients getting the shots anymore. But for a while, I was seeing a couple patients every week, new patients for vaccine injuries.
So what type of injuries are you seeing, and what have you been, what's been helping them?
A lot of POTS, and POTS is where the blood pressure fluctuates up and down dramatically. Neurological, I have one patient in particular that has really bad tremors, but we've actually made some progress with him. Rashes, like severe rashes. I don't know if you saw on Twitter, there was a 15-year-old child that had just horrible rash after the Pfizer shots. He had been on steroids, he'd been on Xolair, he'd seen multiple doctors. And for him, ivermectin worked really well. And that's usually where I start. I usually start with ivermectin because it binds the spike protein. It has anti-inflammatory properties. It actually has 20 mechanisms of action that help with COVID. And so I usually start with that because it's very rare to have side effects. And I have seen such dramatic results with rashes. And one of the frustrating things with these patients is they often don't have a lot on, they don't, their lab results come back basically normal. You'll do imaging, you don't find much. And that's why most doctors will dismiss them or not do anything. So I like the ivermectin because I've seen, like, objectively that rashes that haven't responded to anything else have responded to ivermectin. So I typically will start with that, and then it depends. Like the tremor patient, he did some hyperbaric oxygen, he did beta blockers. He was found to have a copper deficiency, so we're restoring that. But it kind of varies from patient to patient depending on what you're seeing.
For sure. So where's your case with the medical board, the Texas Medical Board currently?
So we had an informal settlement conference, which is behind doors meeting. They submit their expert witness reports, which are anonymous, and there's no opportunity to cross-examine these expert witnesses. So we had that meeting, and basically they offered to drop everything if I was willing to pay them $5,000 and retake the jurisprudence exam, which is a legal exam that we have to take to get our license, and then take 8 additional hours of continuing medical education. And I said, no, I'm not taking that offer. And so the next step is a more formal hearing where I can bring my experts in, they can bring their experts in, but it's not anonymous and they can be cross examined. And that happens in April of next year.
But the reporting, that is anonymous still, correct? Like you'll never know who reported you to the Texas Medical Board?
No, I know who has. I mean, it's not, they don't have to, they can report anonymously, but it's well, for what's going on now, it's Methodist Hospital, and then it's Texas Hughley Hospital, and that case is over the patient Jason Jones. I don't know if you saw it in the news, but he was father of 6. He'd been in the ICU for a month. The hospital was talking hospice, and his wife wanted him to try ivermectin, and he had actually tried to get ivermectin prior to going in the hospital. And the wife sued the hospital to allow him to have it, and just had me come on as the expert witness and the doctor willing to prescribe ivermectin. But we were working under a court order under all of this, but they submitted a complaint to the medical board for unprofessional conduct, even though it was all under court order. So those two have been clumped into one case.
Wow.
And kind of going back to when you had your privileges at Houston Methodist, and obviously they were kind of the tip of the spear when it came to mandates and this oppressive regime, sort of. I imagine that you had colleagues who were aligned with you, in agreement with you, who had similar experiences with you, but we haven't heard from a lot of those people. Was there sort of this silent support for you at some point? And why do you think that most people are not speaking up?
Well, the funny thing about Houston Methodist is I had never stepped foot in there since getting privileges. I was not an integral part of their hospital system. I just had those privileges as a just in case, right? I'm ear, nose, and throat. All of my surgery now is outpatient, and I only need privileges in case there's a surgical complication where somebody needs to be admitted. And I hadn't needed to admit anybody, and I hadn't needed to admit anybody for COVID either. So they used me, though, as an example, to set an example. Like, this is what happens if you speak out. And it worked. I mean, they silenced people. I mean, after what they did to me, no one wants, I was at the grocery store yesterday and somebody recognized me. Now, luckily they were nice, but I can't go around in Houston and not feel like, okay, people probably know who I am after what they did.
Wow.
And you kind of touched on it there, but how has everything in your personal life and your professional life changed since being essentially persecuted by these other entities?
Very publicly, mind you. Yes.
Right. I mean, I am self-conscious, at least in Houston. When I'm outside of the city, I don't feel that way. But I don't go to group events unless I really know the people, or it's group as in a small group. I still, like last week, I had horrible messages left on our voicemail at work saying I was horrible. I can't repeat it, but I still have, the haters are still after me. And I have supportive people as well, but I'd rather just go around and not have anybody know who I am, frankly. Like, I would just, And, I'm not employable. There's no way anybody would employ. If you Google my name, I mean, it, it's not good. Um, and it's little things like, yeah, I'm getting ready to renew my lease, and I'm wondering, can I get a new lease from somebody else, or are they going to Google me and not want to rent to me? That sort of stuff. So but um, thankfully, we're not seeing a lot of serious COVID cases anymore. It's very mild.
Yeah.
Not worried about people needing oxygen. It's astounding to me that they're pushing these boosters, or I don't know. I don't know if they still call them boosters, but the next round of shots. It's astounding to me that they have put it on the pediatric vaccine schedule. I mean, I think that's just the new low. I mean, it actually makes it discredits the entire vaccine program, in my opinion.
I think a lot of the things that they've done, the last 3 years has done a lot to just break up the trust that people once had in public health agencies. And, people like Rebecca and I are like, well, we've been shouting into a void for 8 years now, but that's kind of the silver lining of COVID.
Right.
For most people, at least. I know that we still get hate mail. You obviously get hate mail, and you fear for your future. And I have to say that my heart goes out to you, because it didn't have to be that way. Like Rebecca said, it was very public, but it wasn't you. It was this huge, powerful hospital system using you as an example to scare other people. And I thank you from the bottom of my heart for doing what you did, for reacting the way that you did. But it could have gone a lot differently, and it might have been a much better outcome for everyone.
Well, and let's be clear, these hospitals were just being essentially an advertising marketing arm for the government. And this is what we've been shouting out from the rooftops for years, is just the government is essentially an ad hoc marketing arm of big pharma, because they mandate these shots. They are for profit. They have zero liability. I mean, it's a really beautiful marketing model for not the consumer, but for these vaccine makers. And it's just despicable.
Well, I'm curious what you think about Abbott and not putting this on the special session. And do you think that that's going to happen? And why is he stalling? I mean, I have my theory, but I'm curious.
I would love to hear your theory. Ours, we're ever the optimists, and so we haven't seen a call yet. I've been on the road this morning, so if there was a call that was put out, if he did the proclamation, I'm not aware of it. But so anything could happen between now and October 9th. He has promised multiple sessions, because his priority legislation is going to be a real challenge. I try not to ascribe too many, negative motivations to some of these politicians. I feel like essentially they're out of touch with what we experience on a daily basis. And so they think that SB 29, which was for mandates that no longer exist, obviously they could have come back at any time, but that was local government entities who are no longer mandating closures, masks, or vaccines. They thought that was going to be enough. And you've done a great job. You've been highlighting, I guess last week it was Baylor College of Medicine requiring the COVID vaccine for all staff, students, faculty. We live in a state that just is under the impression that they are as free as can be. And the reality is that we're not. Right. But we'll continue pushing. And I'm so thankful to have your voice in the fight, because you are in it every single day. You're a medical professional, so you have, you don't have your Google degree like we do. So I wanted to touch on that you've been so vocal on social media and elsewhere about legislative policy. It's been sort of a shift from your doctor-patient rights to getting more involved in legislation and policy. Is that, is that somewhere you feel comfortable, or is this something that you just feel that has to be done?
Well, I'm not a political. Prior to COVID, I didn't. I was very politically neutral. I barely voted, and I really don't want to get super political. But this is so. It's a day to day thing for me, and I think the the lawsuits aren't working. We need legislative change. And I worry about Texas because people are surprised. And there's an article from Epoch Times that just came out today about Texas. And people think it's so red, but I think healthcare is turning Texas blue. And we've got the largest medical center in the world. We've got the largest cancer hospital in the country. We've got the largest children's hospital in the country. We've got the largest physicians organization in the country. And they are all pressuring our government. They're pressuring Abbott. They're pressuring the House and the Senate, probably stronger than any other industry. And if you look at the numbers, like healthcare is a dominant industry in Texas, fastest growing. It's the highest source of employment. And the other thing, healthcare physicians used to be primarily Republican, and that has swung over to the other side. Physicians now are primarily Democrats. We're bringing people in from all over into these, big hospitals. So we're being infiltrated from other states that are probably not like-minded. And I think it's really changing the shape of Texas and the way Texas votes. So I think it's a problem. I think that Methodist was chosen for a reason. I think they figured if they can get away with the mandate in Houston, they can get away with the mandate anywhere. And I don't think it was an accident that Methodist was chosen to mandate the shots.
Interesting.
So I also think that, and I empathize with them, but Greg Abbott being in a wheelchair is beholden to his caretaker, his healthcare team, right? He is vulnerable. And I see this with a lot of patients that have serious medical conditions. It's very hard for them to change to a different viewpoint. They are wedded to their care team, and it's very understandable. And to buck that, to go against that would be very difficult. So that may have some role. I have no idea, but that's what may be going on as well.
Well, we're going to get wrapped up, but I just want to thank you again for everything that you're doing. We know firsthand that this is not an easy battle, and you take arrows from every direction. So to have you walk alongside us is a blessing for the movement. And I can only hope that you stay involved and stay engaged and stay as vocal despite, the challenges that presents. But thank you very much for everything that you've done for patients in Texas and across the country, everything you've done to inspire other medical professionals to walk boldly outside of the narrative.
Well, thank you. Thank you.
Do you have any last words or best advice for our audience?
Well, I'm reading Turtles all the way down now. So it looks like it's going to be a very interesting read. I've only read the introduction, but I'm excited. So I'd say just everybody educate themselves and
be informed.
And where can we follow you?
Yeah.
Where can we find you?
I'm active on Twitter. My handle is MD Breathe. And I'm on LinkedIn. And I have a Substack, Day 8. And then my website is breathemd.org.
Fantastic. Thank you very much for your time, and we hope to hear from you and see you again soon.
Thank you for having me.
Thank you. Thank you for listening to the Shot Callers podcast. Please, if you found value in this content, rate us and share the podcast with a friend. It's a great way to get the message out and to empower everyone to make informed decisions. Until next time, never forget, we are the Shot Callers.